Hello, my name is Trach Kelly. Today is August 29th, 2018. It is approximately 12:40, and today I will be conducting trach care suction as well as trach care itself. So I will go and check my physician's orders, go in, introduce myself, check my 2 patient identifiers, and explain to the patient exactly what is going to happen. So I will begin by assessing the patient's respiratory status as well as their O2 status, and I would inspect the area around the trach collar. To begin, I will perform hand hygiene, open my suction kit away from me, don on sterile gloving, and I will also talk with the patient to get a communication signal just in case that they can't breathe or they're uncomfortable. I will get that together, and I've already provided privacy for my patient as well as brought them to a comfortable working height for myself. So I will don on the sterile gloving. Fix this part. Alrighty. I will then move this out of the way. So now I will take this sheet and place it under the client. Shiny side down. And I will begin by opening up my saline. There it goes. And getting out my suction catheter. I'll make sure that the tip of the suction catheter does not touch in here. Using my non-dominant hand to secure it. And the suction will be about between 80 and 120 for the suctioning. So I will let them know I'm about to go in. And first I'm going to make sure the suctioning is working by intermittently going into the saline. And it is working. So now I'll go in. 1, 2, 3. In the pass shouldn't be too long. Come back out. Suction it. And as I'm suctioning, I will make sure to look and mentally document what is coming out so I can make sure to document it when I start charting. And then come out. And usually when suctioning, it shouldn't take more than like 2 or 3 passes unless it is really gunky in there. And the last one. Ready? 1, 2, 3. Make sure not to go too far so you don't get into the bronchioles. Alright. And that is about done. I will discard of this. And I will remove my gloving and make sure that the patient is comfortable and remove and clean up my site. So now I will go into the trach care. Move this stuff out of the way. Now I will I will perform hand hygiene, I'm sorry. And now I will go into the trach care kit. Don on more sterile gloving. Pretty sticky. Alright, now I can fix it. So once this is fixed, I will explain again what is happening after the suction. I'm just going to be cleaning around it. So I will start by moving this out of the way. And I have a sterile towel, so I'm going to use my non-dominant hand and spread this out so I have more room for the supplies that are in my kit. So for that, I have to go in with this sterile towel right here, open it up and slide it under my patient. Alrighty, and now I'm going to set out my supplies. So I have the new cut for the trach, the cut gauze. I have the pipe cleaner for the inner cannula, Q-tip to go around, and the rest. More gauze and ties if needed, but his ties seem to be pretty clean, so I don't think I'll be able to or need to change the trach ties today. So I will get some normal saline and peroxide. Half of the normal saline will go in one chamber and the rest in the other, and then the peroxide will go in the one of the other chambers. You can choose whichever. So to start, I'm going to pull out the inner cannula, and it has to come out at about an angle. So, and I'm gonna put it in the peroxide, half peroxide solution. Let that soak and do its thing. And then I'm gonna slowly pull out the trach gauze and inspect it for the drainage that it has, so I can know what to document, and I will toss this. So, with that being said, I will take a Q-tip and go to cleaning it. So, maybe I could get some saline on here to help, and there seems to be no skin irritation, so that's perfect. Make sure I'm getting a good scrub. It looks like dry boogers usually around it, so that's typically what it looks like, and I'll discard this. So now I'll begin to clean my inner cannula. And I'm going to make sure I can get in both sides. And I'm going to let it soak in the saline now. And once it's doing that, I'm going to dispose of this and get my gauze prepared to go around the trach. Now that that's ready, I'm just going to slip this under, and you can have another person in here for two-man assist, but for today we won't be doing that. And make sure it's under there, and make sure that the client is comfortable at all times, because that's important. Make sure you get it all the way around there, because you don't want any of the gunk to get on the skin, because that can start to cause skin breakdown. So now, hopefully this will be drying, because you should let it dry before putting in there, but for the purpose of the video, I'm going to go ahead and insert it, and you should go in at an angle. And once it's down, make sure you hear the click. Okay, I will clean up my area, make sure my patient is feeling okay, they're comfortable, they have their call light, they're in a low position, and I will go document this procedure.